Imagine a world where healthcare costs make sense, where you actually have more control over your care. And doctors aren't, like, drowning in paperwork.
Yeah.
Sounds pretty utopian, right?
Yeah.
Well, that's what we're diving into today.
Okay.
Tom Woods' free ebooks on healthcare to explore how we might actually achieve that. Now, fair warning, if you're completely happy with how American healthcare is right now, this deep dive might challenge some pretty deeply held assumptions.
Yeah, that's because these ebooks are really pushing back against the kind of conventional wisdom,
Yep.
And they're available for free at tomsfreebooks.com.
Right.
Talking about Tom Woods here.
Exactly.
New York Times bestselling author,
Wow.
recipient of the Hayek Lifetime Achievement Award.
Okay.
Not exactly someone who shies away from, controversial ideas.
Exactly. And what's refreshing is that he doesn't just critique the system. He offers, like, concrete alternative solutions. This isn't just theoretical. He showcases real-world examples of how things could be different. And that's where we're going to unpack today.
Yeah, the overarching theme here is think and act locally.
Got it.
Emphasizing personal empowerment, community-based solutions
Yeah.
over top-down control. He really makes you question whether more government involvement is truly the answer to our healthcare woes.
Okay, let's unpack this. In his book, Your Facebook Friends Are Wrong About Healthcare, Woods dives into how American healthcare became so dysfunctional.
Yeah.
The historical context.
Right.
He argues that employer-provided insurance, Medicare and Medicaid, well, I think well-intentioned,
Yeah.
ultimately led to some pretty serious unintended consequences.
Yeah, it's fascinating how these programs designed to expand access and affordability,
Yeah.
actually ended up distorting the market and driving up costs.
Yeah.
A key concept here is third-party payment. When someone else is footing the bill, whether it's an employer or the government, both consumers and providers become less sensitive to the actual price tag.
So it's like going out to dinner with a friend who insists on paying. You might be more likely to order that extra appetizer.
Yeah.
Or a fancy cocktail knowing it's not coming out of your wallet.
Precisely. And the same thing happens in healthcare. When you're not directly paying for services, you're not as motivated to, shop around for the best price.
Right.
And providers, knowing that someone else is picking up the tab, might be more inclined to offer expensive treatments or tests,
Yeah.
even if they're not strictly necessary.
And Woods uses a striking anecdote to illustrate this point. He talks about a former Google engineer named Vijay Boyapati, who needed a small cyst removed.
Right.
And Boyapati decided to shop around, and the price discrepancies he encountered were astounding.
Yeah.
A dermatologist's office, used to dealing with insurance, quoted him $700 for the procedure. But at a cash-based clinic that catered to lower-income patients, he paid less than $50 for the same procedure, performed by a board-certified doctor.
Wow.
Less than the price of a copay in some cases.
Right.
It really highlights how distorted the market can become when third-party payment dominates.
Exactly. And this distortion is further exacerbated by things like the American Medical Association's control over medical school accreditation.
Okay.
By limiting the number of doctors entering the field, they've effectively restricted the supply of physicians, which drives up prices.
It's like trying to buy concert tickets when there are only a limited number of seats available.
Yeah.
The price is going to skyrocket because the demand outweighs the supply.
Right. And then you add things like certificate of need laws.
Okay.
Which sound good in theory, but often have unintended consequences. These laws require healthcare providers to get government permission before opening new facilities or offering certain services.
So wait, the government is essentially deciding who gets to provide healthcare and where.
Yes, and while the intention might be to prevent unnecessary duplication of services,
Right.
in practice, these laws often create monopolies for existing hospitals, stifling competition,
Yeah.
and preventing new, potentially more affordable options from emerging.
So we've got this system where costs are artificially inflated, supply is restricted, and consumers are largely insulated from the true price of healthcare.
Right.
It's no wonder the system is such a mess. But what are some of the alternatives Woods proposes?
Well, he highlights several innovative solutions that are already working,
Okay.
like Dr. Josh Umber's direct care practice, Atlas MD.
Right.
It's a fantastic example of how a market-based approach can deliver both lower costs and higher quality care.
Okay, so what exactly is direct care?
Think of it like a gym membership for your healthcare.
Okay.
Patients pay a flat monthly fee, and this covers unlimited visits,
Wow.
basic procedures, and even medications at significantly reduced prices.
So no copays, no deductibles, no fighting with insurance companies?
Okay.
Sign me up. But seriously, how does a doctor make a living with this model?
Well,
It sounds too good to be true.
by cutting out the insurance middleman
Okay.
and the administrative burden that comes with it,
Yeah.
Umber can offer significantly lower prices while still providing excellent care. Okay.
He's focused on creating value for his patients through transparent pricing, convenient access, and a strong doctor-patient relationship.
Okay.
And the results are impressive.
I've heard about some incredible cost savings with direct care. Tell me more.
We're talking about blood work for 97% less than what you'd typically pay, medications dispensed for pennies, and an overall reduction in healthcare costs by 80–90% for his patients.
Those numbers are incredible. It makes you wonder why this model isn't more widespread.
Well, Umber argues that we've been conditioned to think of insurance as the only way to pay for healthcare, but it's really not. He believes we should be using insurance for catastrophic events, not routine care. And he's actually optimistic that Obamacare, with its rising premiums and complex regulations, might inadvertently drive people towards innovative models like direct care, out of sheer necessity.
It's like the old saying, necessity is the mother of invention. But what about people who can't afford even a low monthly fee for direct care? Are there other options out there? Absolutely. Woods explores another fascinating alternative. Healthcare sharing ministries. These aren't insurance in the traditional sense, but rather groups of people who agree to share each other's medical costs.
I've heard of these, but always wondered how they actually work in practice. It sounds almost like a modern take on those old fraternal organizations that used to offer, mutual aid to their members.
That's a great comparison. Woods actually delves into the history of these organizations, showing how they successfully provided affordable healthcare for decades before government intervention became so pervasive. He interviewed Dale Bellis, the executive director of Liberty Health Share, for one of his podcasts, and it's a real eye-opener.
Okay, so Liberty Health Share. Tell me more about how this model works. Do they have monthly premiums like traditional insurance?
Instead of premiums, they have monthly share amounts,
Okay.
which are often significantly lower than what you'd pay for a traditional insurance plan. These contributions go into a shared pool that members can draw from when they incur medical expenses.
Okay, so it's kind of like crowdfunding for healthcare, but with a focus on shared responsibility and community support.
Exactly. And they have a system for negotiating fair prices with healthcare providers up front, which helps keep costs down. Remember that $42,000 hospital bill you mentioned earlier?
Oof, don't remind me. Even after our insurance discount, we were still on the hook for thousands of dollars out of pocket. It felt like we were being punished for having the audacity to get sick.
Right, and that's with the supposed negotiating power of a large insurance company. Liberty Health Share aims to cut through that bureaucracy and establish transparent, upfront pricing for medical procedures.
That sounds incredibly appealing, but I'm curious about the faith-based aspect of Liberty Health Share. How does that influence their approach to healthcare?
While rooted in Christian principles, they don't require members to adhere to a specific faith. The focus is on shared ethical values like personal responsibility, compassion, and a commitment to helping those in need.
So it's less about dogma and more about creating a community of people who share a common set of values and are willing to support each other through difficult times.
Precisely. And it's not just about cost savings. Many members find a real sense of community and purpose in being part of this shared endeavor. They can connect with each other, offer support, and even pray for one another. It's a very different experience than the often impersonal and transactional nature of dealing with traditional healthcare.
It's fascinating how this model taps into the power of community and mutual aid, something that seems to have been lost in our, modern hyper-individualistic society. But surely there must be some drawbacks or limitations to this approach, right?
You're right, it's not a perfect solution. One potential challenge is that this model requires a shift in mindset toward being more proactive about your health and making cost-conscious decisions. It's not a passive system where you just pay your monthly share and expect everything to be taken care of. You have to be more involved in your healthcare choices and weigh the costs and benefits.
So it requires a higher level of personal responsibility and engagement with the healthcare system.
Exactly. And for some people, that might feel daunting. It also might not be the best fit for people with pre-existing conditions or those who require frequent or specialized care, but for those who are seeking a more affordable, community-oriented approach to healthcare, sharing ministries like Liberty Health Share offer a compelling alternative.
It's really eye-opening to see how these alternative models are challenging the status quo and providing real solutions for people who are fed up with the traditional healthcare system.
And Woods doesn't just focus on alternative models, he also brings in the voices of physicians who are on the front lines of this healthcare battle. He interviewed Dr. Jane Orient, a seasoned MD,
Right.
and executive director of the Association of American Physicians and Surgeons, an organization that champions patient freedom and physician autonomy.
I'm always interested in hearing from doctors who are willing to speak out against the establishment. What are some of Dr. Orient's key concerns about the current state of healthcare?
She's a staunch critic of government overreach in medicine, arguing that programs like Obamacare have created more problems than they've solved. She's particularly concerned about the impact of government mandates on the doctor-patient relationship.
I can imagine how, bureaucratic red tape and complex regulations could interfere with a doctor's ability to provide personalized care.
Absolutely. Dr. Orient argues that these regulations force doctors to spend more time navigating bureaucratic hurdles than actually caring for their patients. And this ultimately leads to higher costs and potentially lower quality care.
It's like trying to have a heart-to-heart conversation with your doctor while a government bureaucrat is constantly interrupting and telling you what you can and cannot say. It's enough to make you want to pull your hair out, and ironically, that might be another medical expense you'll have to deal with.
That's a good point. And it's not just Obamacare that she's critical of. Dr. Orient also points out the perverse incentives created by Medicare, the government-run health insurance program for seniors.
I've heard that Medicare's reimbursement rates are often so low that many doctors are reluctant to accept new Medicare patients. Is that true?
Unfortunately, yes. This creates a two-tiered system where seniors, who often have the most complex medical needs, have fewer choices and longer wait times for care. It's a classic example of how government intervention, while well-intentioned, can have unintended consequences that actually harm the very people it's supposed to help.
It seems like a recurring theme in these ebooks is that the government's attempts to fix healthcare often end up making things worse,
Yeah.
creating more bureaucracy, more complexity, and ultimately higher costs. It's enough to make you wonder if they're even trying to solve the problem or just perpetuate their own power.
That's a provocative question, and one that Woods encourages his readers to grapple with. But he doesn't just leave us with a critique of the system. He offers some compelling insights into how we might move toward a more market-based approach to healthcare.
So what are some of the key principles of a free market healthcare system, and how do they differ from the current model?
Well, a key principle is empowering consumers, to be more active participants in their healthcare decisions.
Yeah.
Right now, we have a system where third-party payers, whether it's insurance companies or the government, largely dictate what care is covered and how much it costs. In a free market, consumers would have more direct control over their healthcare dollars and could shop around for the best value, just like they do for any other good or service.
It's interesting because we take that for granted in so many other areas of our lives, right?
Yeah.
We compare prices, we read reviews,
Right.
we make informed choices about, everything from groceries to cars to vacations.
Yeah.
But somehow when it comes to healthcare, we've been conditioned to accept this opaque bureaucratic system where we have very little say.
Exactly. And that lack of transparency and consumer choice is a big part of why costs have spiraled out of control. Woods argues that if we want to see real change in healthcare, we need to inject more market forces into the equation. This means reducing the role of government and empowering consumers to make their own healthcare choices.
But what about the argument that a free market approach would leave the poor and sick behind? That's a common criticism I hear from people who defend the current system.
That's a valid concern, and it's one that Woods addresses head-on. He argues that government programs like Medicaid, while well-intentioned, have actually made things worse for low-income Americans by creating a system where providers are incentivized to avoid serving those patients.
It seems counterintuitive, but I can see how that might happen, right? If the government is only reimbursing providers a fraction of what it costs to deliver care.
Right.
It makes economic sense for them to focus on patients with private insurance or those who can pay out of pocket.
Precisely. And this creates a two-tiered system.
Right.
Where those who are most in need often receive the lowest quality care.
Right.
Woods argues that a truly compassionate approach would empower low-income individuals. to have more control over their healthcare dollars,
Okay.
allowing them to choose providers who best meet their needs.
So rather than relying on a top-down bureaucratic system, he's advocating for a more bottom-up approach that emphasizes individual choice and personal responsibility.
Exactly. And he highlights some really compelling examples of how this is already working in practice. We talked earlier about direct care, which offers affordable, transparent pricing for routine medical services. He also discusses healthcare sharing ministries, which provide a community-based alternative to traditional insurance.
And it's not just about cost savings, right? These models often foster a stronger sense of community and mutual support, something that seems to be lacking in our current system.
Right.
It's almost like a return to a more traditional way of caring for one another.
That's a great point. And this idea of thinking and acting locally is central to Wood's philosophy. He believes that the solutions to our healthcare crisis won't come from, Washington, D.C. or some distant bureaucracy,
Yeah.
but from individuals and communities taking ownership of their own health and well-being.
So it's about empowering people to be proactive rather than reactive.
Right.
To seek out solutions within their own communities rather than waiting for the government to, fix things.
Exactly. And Woods provides a really thought-provoking analogy to illustrate this point. He compares the rapid innovation we've seen in the tech industry, with the development of the iPhone as a prime example,
Yeah.
to the relative stagnation of healthcare technology, which is bogged down by government regulations and bureaucratic red tape.
It's a great analogy.
Hmm.
Think about how quickly smartphones have evolved in just a few decades,
Right.
becoming more powerful, more user-friendly, and more affordable. Imagine if we applied that same level of innovation and market competition to healthcare.
That's what Woods is advocating for, unleashing the power of the free market to drive innovation, lower costs, and improve quality in healthcare. He believes that by removing government obstacles and empowering consumers to make their own choices, we can create a more dynamic, responsive, and ultimately more humane healthcare system.
It's a powerful vision, and one that challenges us to rethink some deeply ingrained assumptions about the role of government and the nature of healthcare itself. So what's the key takeaway for our listeners? What can they do to start thinking and acting locally when it comes to their own healthcare?
The first step is awareness. Recognize that the current system is broken and that the solutions being offered by politicians are likely to make things worse, not better. Then start exploring the alternatives. Read Tom Woods' free ebooks, check out organizations like Atlas MD and Liberty Health Share, and talk to your doctor about direct care options.
Yeah, don't be afraid to think outside the box and challenge the status quo. The answers to our healthcare crisis might not be found in some, grand government program, but in the innovative ideas and entrepreneurial spirit of individuals and communities working together to create a better system.
Woods' work reminds us that we have more power than we realize to shape our own healthcare destiny. We don't have to be passive recipients of a broken system. We can choose to be active participants in creating a healthier, more affordable, and more fulfilling healthcare experience for ourselves, our families, and our communities.
That's an inspiring message to end on. So if you're ready to dive deeper into these ideas, head over to tomsfreebooks.com and download those free ebooks. You might be surprised at what you discover. And as always, thanks for joining us for this deep dive into the world of healthcare alternatives.